am Dr. Laura Brayton. I am the host of Well-Adjusted Mama, and today's topic is on craniosacral therapy. I'm really excited to have my friend Eula Katsoulis here to talk to us more about craniosacral, specifically being used during pregnancy and with infants. Eula is a licensed massage therapist, 1994, specializing in visceral manipulation and craniosacral therapy. She practices in Philadelphia and New York City. She studied at the Upledger Institute, internationally known for its pioneering work in craniosacral therapy as developed by Dr. John Upledger, D.O. Welcome, Eula.
Hi, Laura. I'm happy to be here. How are you?
Doing well. So glad to have you here as well. I have personally worked with you for craniosacral therapy and received your care, and have referred patients to you for craniosacral therapy, and have really been blown away by what I've experienced and seen changes with patients. So I'm excited for you to share with our listeners a little bit more about what this technique is. So can you just describe to us what craniosacral therapy is?
Sure. The craniosacral system is the membranes, cerebrospinal fluid, and bones that surround and protect the brain down to the spinal cord, to the sacrum. It is part of the central nervous system, which is the master system of the body that controls all the other systems. So they live in the same place, i.e. the brain and the spinal cord. So it's very subtle, as it deals with the cerebrospinal fluid, but works on a really deep, profound level to initiate change in the body. And how it works briefly is the cerebrospinal fluid is made in the brain, in the third and fourth ventricles, respectively, and it surrounds and bathes the brain, and also surrounds and bathes the spinal cord. And the theory is if there's any blockages or restrictions along the spinal cord, this pressure, this fluid becomes stuck, and backup pressure happens, creating pain such as low back pain, for example, neck pain, chronic headaches, TMJ, and the like, for starters. So a craniosacral therapist, what he or she does is by applying a very light pressure, the weight of a nickel, we monitor and see where the cerebrospinal fluid is moving or not moving, and we act as facilitators to initiate change in the system. So we use very gentle techniques to get the fluid moving, so to reduce pain. It's an excellent pain management tool, and it's an excellent preventative tool. If you'd like to come in for monthly maintenance sessions, for example, it's an excellent tool to nip things in the bud, any aches and pains, any imbalances that you might feel, for example. It's a good way to go.
Mm-hmm. And I think one thing, to me as a chiropractor, I really value the health of the nervous system. It's the computer of our body. It's how our brain, communicates with the rest of our system and controls it. And it is powerful to have a modality like craniosacral that is purpose is to nourish and support the health of the brain and spinal cord.
Yes, absolutely. That is the ultimate intention of this work, is to nourish, protect the brain and spinal cord, and also just to give it a little oomph. I act as a professional nudger to get this cerebrospinal fluid to move and do its work, and also that has a profound effect on the nervous system, as you said, the computer of the body. So I usually tell people that this computer needs 24 to 36 hours to process this new information that has occurred during and post-session.
That is interesting. And I think the other thing that a lot of people may not be aware of is that even as adults, the plates in our skull do not fuse and become one solid bone. There is actually movement, even though it's very small, between those sutures of the skull, and that's the work that you're addressing, to continue to have proper movement when people breathe in and out, to movement of the skull to help the movement of the cerebrospinal fluid.
That's right. That's a respiration of sorts. It's called primary respiration, and it helps those sutures breathe in its own right. And breathing in this situation is about movement, because movement is life itself. So we want things to move properly. We want that fluid to move where it needs to move, go where it needs to go, and have all the structures, all the membranes within the brain itself, in and around the spinal cord, to be supple and elastic and have this movement going with the cerebrospinal fluid. So it's you're absolutely right. The sutures do move, and the whole body is dynamic, and it's under change constantly. So we use this work to have it at a nice equilibrium.
Right. So a woman who is pregnant can also benefit from craniosacral therapy.
Yes, a woman who is pregnant can benefit from craniosacral therapy. I do see quite a few pregnant women in my practice, and they come to see me for various reasons. Such as chronic neck, back, and joint pain, for example, headaches and migraines. Morning sickness is a big one. Any sort of fatigue or stress or tension that they're undergoing through their pregnancy, any emotional difficulties that they might be going through. These are some of the things that can help women who are pregnant with craniosacral therapy. And I also want to add, I have been seeing a couple of women who want to conceive, and they are currently undergoing IVF. And what this work does, it actually, how can I say it? It's getting the house in order for conception to take place. So it balances and calms the nervous system, so preparing it for conception, along with IVF and other modalities that a woman is using. And I highly recommend this type of work for women who do want to conceive. It's very, very helpful and might be a great aid in conception itself.
That is such a great, valuable point for preconception work, because a lot of times with fertility challenges, there's a very large stress component of why that woman is having difficulty conceiving, more so than a physical issue. And the fact that you're mentioning that craniosacral therapy is helping to calm the nervous system and take some of that stress off the system, it's obviously the computer will be working more effectively when it's less stressed. So that makes so much sense.
Yes, and another great benefit with this work is it helps the birth become easier. The woman is much more calm and balanced because of the nervous system being that way, and births have been known to be a lot easier, less stressful, saving on the labor involved in giving birth. A lot of women have reported a much more relaxed, calm pregnancy. So it's definitely up there in terms of what you can do to have a safe pregnancy, what you can do to have a healthy, calm pregnancy and delivery.
And one of the interviews I've done already for this podcast was with a psychologist discussing about stress and anxiety during pregnancy and all the biochemical changes that occur when a woman's under stress and how that impacts her baby, and not even just in utero, but for the rest of the child's life. and because they start to develop that fight or flight stress, chemistry as a fetus. So I could see why craniosacral therapy could be so valuable for women preventively to just help support them emotionally through the pregnancy and even in preparation for birth, where there can be a lot of fear of giving birth, and helping them just really connect to a deeper source while they're in labor.
Exactly, because it's a partnership between the woman and her baby. So by working with this partnership, ensures a far deeper connection, and applying the craniosacral work during a new mother's first labor and delivery appears to assist the mother through subsequent labors and deliveries. So a subsequent delivery will be easier because craniosacral therapy was applied to the first labor, for example. Other advantages to this work is that moms report recovering more quickly, and that the adjustment to motherhood is not that difficult, like you were saying, stress-inducing or anxiety-inducing, compared to if you've had your second child and, for example, you're using craniosacral therapy on your second child, perhaps you didn't use it with your first child. Mothers are reporting that this birth was a lot easier and they felt a deeper emotional connection with their child. So these are some things that are really valuable, such as also with C-sections, infants born to those mothers who have received epidurals have shown non-negative effects of the epidural, which is really huge. As more and more C-sections are being performed in this country, I think that's a really big benefit to this work.
So you're saying that an epidural, whether it's a C-section or vaginal delivery, by that infant getting craniosacral, their impact from the epidural is reduced?
Exactly. They're starting to do preliminary studies where infants born with epidurals, whether vaginal or C-section, they appear more anxious, for example, and later on they might have learning difficulties, they might have digestion problems, they might have latching difficulties. So,
colic.
I'm sorry?
Colic,
another example. So with using the craniosacral therapy, it really greatly reduces those types of side effects from an epidural.
I just think it is also so fascinating that craniosacral therapy can be used with newborns and infants, and is hugely valuable. One example you just gave is with reducing the stress of an epidural on an infant. But another reason I've seen that is really valuable is related to birth strain. And that happens pretty frequently also, whether it's a vaginal delivery or a cesarean, where there is some strain on the infant's alignment during the birth process, and that can create misalignments in the skull and the spine, which will impact that movement of cerebrospinal fluid. So I know you've done a lot of work with infants as well to help reduce that strain.
Right, exactly. As an example, infants who are born with torticollis, for example, because of that strain, have impaired alignment and therefore impaired cerebrospinal fluid movement. So I have worked on infants with torticollis. Also, infants who have latching difficulties, infants with hydrocephaly, for example, plagiocephaly as well. So what I love about infants is that they're a clean slate with their nervous systems being so young, and all it takes is 1, 2, 3 sessions at the most, and the restrictions are resolved for these types of issues from a birth strain.
Yeah, it's fascinating how quickly their bodies heal and respond to holistic modalities, including chiropractic as well. And I've seen infants with plagiocephaly, which is that flattening on the back of the head, and that's usually related to a torticollis, which is like a neck head tilt. And it's something that it's important for that infant to get body work, like craniosacral therapy and chiropractic, to help address that alignment so it doesn't progress and become more symptomatic and more sustained, and it can start to actually lock into that infant's nervous system if it's not addressed. So it's great to get the babies as young as possible. What's the youngest you've worked on?
Oh, the youngest I've worked on was 24 hours old.
Mm-hmm. Oh, that's beautiful.
Oh, yes, it was a beautiful experience, and she did have birth trauma. The mother was in labor for over 20 hours. She was born with a cord wrapped around her neck. She had torticollis and latching difficulty. So I worked on her for a couple of sessions, and what's, like you said, the beauty of the nervous system when they're so young is that all those restrictions get cleared away. So it's basically what we're talking about is early intervention with chiropractic and craniosacral therapy. So, get the kinks out as early as possible so they can thrive and have healthy nervous systems further on down the line.
Right, and especially at that age, they're growing and developing so rapidly that it's best to remove any interference from their nervous system so that growth is optimal. And I've certainly seen it be extremely preventive for helping with common infant complaints that don't have to develop if the infant's treated soon after birth. And also I want to mention a little bit more about latching issues, because that's can be a big issue for a lot of moms, new moms especially, who have never nursed before. And, they may go for like a tongue or lip tie release, and they could still possibly have a latching issue, and that's because they still have a structural issue that needs to be addressed. Have you worked with infants that had like the tongue or lip tie release and they benefited with craniosacral?
Yes, I have, and there's definitely, like you said, a structural component. So I work in and around the cranial bones. I also insert a glove and put a finger into the infant's mouth and do a little bit of mouth work to open up the structures there to make sure everything is in alignment. And so I also check the sucking reflex with my finger and see if there's a nice latch post tongue or lip tie procedures, and it really makes a difference. So I tell parents that if their infant is scheduled for a tongue or a lip tie procedure, it is best to come before the procedure and also after the procedure. Coming before sets the stage for a successful procedure with the nervous system and the musculoskeletal system healing properly and quickly, and then coming post-procedure just to make sure everything is okay, and then just to check the alignment and to see if the fluids are flowing and the structures are sound and in alignment, and that really makes a big difference with latching difficulties.
Mm-hmm. And it can make such a difference in both the baby and mama's life, because it can be so frustrating for a new mother if the baby's having latching issues. The baby typically is crying and they're frustrated and they keep pulling off, and the mother has horribly bloody, sore nipples, and it's such a frustration that can be resolved with some additional support with some craniosacral therapy and chiropractic, and it's very safe and gentle and really effective and doesn't require a lot of treatments. It's really, like you mentioned, a very minimal type approach that has huge benefit.
Yes, absolutely. And I also advise that the moms come in for a session themselves to basically balance their body, mind, and spirit post-pregnancy, and to see if there's any residual structural effects going on from the pregnancy. And also it makes them feel much more calm and balanced, and they understand at a very deep level the type of work I'm doing on their infant when they receive the work themselves. And I really do think when they do receive the work, it creates a deeper connection between mom and baby, because they're both receiving this type of work, and their nervous systems both get it. And I think when their nervous systems get it, then they definitely have a deeper bond amongst themselves.
That's so hugely valuable.
Absolutely.
Yeah.
For the mom to be grounded and centered in her body, because her body went through so much upheaval during the pregnancy itself and then during the birth itself. So it's nice for the mother's body to be as centered and free of any restrictions, and ready to transition to being a mom, if that makes sense.
Oh, yeah, because it is such a huge transition, physically, mentally, emotionally, spiritually. So I love that this work is kind of working on all those different levels.
Absolutely, and all it takes is a very, very gentle touch. Like I said, the weight of a nickel, and it works on a deep level, because we're just really honing in on the nervous system and really allowing it to do what it needs to do to achieve balance in the body.
Right. So it's allowing the body to heal itself as opposed to something coming from the outside in. The body's actually healing from the inside out.
That is the beauty of this work in a nutshell, is that what I basically think of myself as is a facilitator, where I'm just listening and following to the nervous system and seeing where it needs to go and going along with it and assisting it and giving it a nudge every now and then to go to its greatest potential of self-correction and healing. So it's a beautiful thing just to really go in without an agenda and just follow what the nervous system wants to do and guide it, so to speak, facilitate where it wants to go in order for it to self-correct and heal itself.
Well, this is such valuable information. Eula, if our listeners do not live in New York or Philly and are looking for a qualified craniosacral therapist, is there a website that's out there for people to find a list?
Sure. There's www.upledger.com. That's upledger.com. That is the website of the Upledger Institute, where I received my training and my craniosacral certification. They have a website that has a tab that says Find a Practitioner. So all you need to do is either put in your zip code or the city and state in which you live, and you will be able to find practitioners in your area.
That's wonderful. And then, of course, if they are living near New York City or Philly, they can check out your website. Would you let us know what that is as well?
Sure. It's www.stillpointholisticstudio.com. And Still Point is spelled STILLPOINT. Holistic, HOLISTIC. Studio, STUDIO.com. stillpointholisticstudio.com.
Great. Well, Eula, I really appreciate you taking your time to come on the show and talk to us about craniosacral therapy.
Thank you so much, Laura. I had a great time answering questions, and I love what I do. I'm very passionate about it, and I love sharing my expertise and insights into craniosacral therapy, and I hope this was helpful for all the people listening.
Mm-hmm. Well, I certainly learned a couple new things myself, so it was wonderful. So thanks again, Eula.
Okay. Thank you, Laura.
Bye.